Hi, I'm Millie. I'm a second year medical student at BSMS and I'm going to be showing you what a week in my life looks like. So I'll start by introducing myself. I am from Norfolk. I did a gap year, so I started a year later than other people. In my gap year, I worked as an au pair, which I loved, and now I live in Brighton. So in terms of my interests, I play sports. I play football, which is a new sport to me since starting at BSMS. I play with the BSMS women's and I've really enjoyed it. I also play hockey. I'm the vice captain for the hockey team. And I've recently joined the charity fight night, hence the slightly black eye, which hopefully by the end of the week will be looking a bit better. I also enjoy going to the gym and crocheting, and I'm on a few societies at BSMS. So I'm part of the MedSoc. This year I was Freshers Rep, so I organised Freshers Week. And I'm also on Refugee Support Soc, Peds Soc, Anat Soc, and I like to get myself involved in as many things as possible because BSMS has so much to offer in terms of societies. Okay, so I'm going to be taking you through what my week looks like. This week's a pretty normal week, a combination of lectures, some clinical stuff, some practicals. So today is Monday and all I have today is DR, which is the dissection lab. I really enjoy DR. It's probably one of my favourite things that we do in first and second year because it helps me learn so well. In first year we do dissection, but in second year we only do prosection, but it makes a lot of sense because lots of the structures that we are looking at are so detailed and fine that the prosections are so well made that it's much easier to see the anatomy that we're trying to learn about. So I'll take you through what my week looks like. My DR wasn't until 12, so I spent the morning doing some work, having a nice brunch, and then I cycled into uni. I tend to cycle quite a lot. I find it really easy in Brighton because there are so many bike lanes. And then I got to the MTB and we had DR for 2 hours. And then I went to Sussex Library to get some more work done. I cycled home and did some more work and made my dinner and then started on my SSC presentation, which I'll explain a bit more about in a second. So it's Tuesday today, and today I have had my SSC this morning, which is a student selected component. We do 2 in second year and they're really interesting extra bits of teaching that you get to do. So I'm doing these drawing classes looking at anatomy and then also just sort of the benefits of drawing on your mental health and in health in general. After the SSC, I then had a lecture on memory and learning, which was quite hard to wrap my head around because we were learning about learning. But that's quite a lot of what this module is this year. For first term of second year, we do neuroscience, which is challenging, but it's also really interesting to understand how things all work. And then the last thing of my day at uni today was a module tutorial on action potentials, which was just consolidating some stuff that we had learned much earlier in the term. So I then left the medical teaching building and came home on my bike to make some lunch. I then spent the afternoon doing some work, writing up some lectures and preparing for the next couple of days. I tend to use a mixture of Anki making and Notion notes, and then when it comes to revision, I do lots of mind maps. So once I'd finished everything that I wanted to do today, I made my dinner and had it with my housemates. I then got myself ready for fight night training, which was from 7:30 till 8:30, and I cycled there and back along the seafront, which I always enjoy. And that was pretty much it for my day. So it's Wednesday now. Usually Wednesdays we have lectures in the morning and then the afternoon off for sports or catching up with work. But strangely today I had no lectures, no university. So I started the day with a coffee with a friend, which was really lovely. I then spent the rest of the morning doing some work, catching up on bits and bobs and preparing for my lectures on Friday. Later, I went to the gym with a friend and then went to another cafe to do some more lecture prep. I then came home and had some lunch and spent the afternoon not being super productive, but got a bit of work done. I then went back to campus and did BSMS women's football training, which is a new sport to me, which is really fun. I came home, made my dinner and did the pre-learning for tomorrow. Okay, so now it's Thursday, which is our clinical day. We had a seminar on cranial nerves, which is what I was doing the pre-learning in preparation for. It was quite interesting and practical. I then cycled home because I needed to get ready for my community hospital placement. So my community hospital placement was up in Crawley. So we took a train and a taxi to the hospital and then spent the afternoon taking histories from patients on the wards. It was really interesting and it was actually my first chance properly taking histories from patients. Then I had hockey training with BSMS mixed hockey, which is always really good fun. So it's Friday today. This morning we had a symposium, which is like a long lecture with a patient in it. So we have patient experts who come and speak to us about their conditions, and it really helps consolidate what we've learned about the condition and then the actual clinical aspects of it, which is really helpful. We also had a few lectures and a phase lead forum. The phase lead forum is a chance for us to feed back to the people who are running our course and to the medical school about anything that's going well or needs changing. So my day was pretty normal. We started at 9 a.m. I cycled into uni and then we had the symposium that I mentioned. And in the gaps in between lectures, I did some work at the MTB and handed out some of the BSMS merch. We then had one more lecture. I then came home, did some work, made my dinner and got ready to go to boxing training again. And that's pretty much everything I did this week. And here are a couple of clips of the lovely seafront cycle that I get to do. Thanks for watching. I hope it gave you a bit of an insight into what a week in the life of a second year medical student is like at BSMS.